Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars and pigmentation, and I do a lot with collagen stimulation. I want to focus tonight's show on acne scars. I'll focus on this particular result, how we achieve this result. This was not under a single session. This was multiple sessions over the course of a couple of years. And I'll walk you through just how I did it and really hopefully demystify some of the process for scars and how we can really achieve results like this over and over and over again. Especially if we get enough time, we have enough patience, and enough commitment also from patients to make sure that they're wearing their sunblock properly, they're following the steps, they don't start smoking or vaping, things like that. So I'll walk you through all that and hopefully give you some guidance on what you could do for your scars, even if you're not near me. Just get some ideas for the best practices for skin conditions, and you'll hopefully be able to get people to understand that certain treatments aren't going to be particularly helpful for scars, but some other things, it could really work very, very well, especially if you work on remodeling that skin over time. And also give it a little bit of volume. And so that's what we're going to talk a little bit about today. Danny will be happy to help you. Danny's saying, I need this. I'll be happy to help you out with that. This is a slow process. These are thick scars in a patient who is Hispanic, so Fitzpatrick 4. She also had a little bit of melasma as well. So we have to be very, very careful with lasers and energy devices, but we still ended up getting this kind of result. I did do ablative CO2 laser a couple times on her. I also did a subcision on her one time. I did dilute form of Radiesse as well as Sculptra for her. So I did a few different things, also some Bellafill to give her some volume. And we did some TCA Cross in the ice pick scars as well. So a lot of work was involved in this process, but it's obviously very, really rewarding. And what's also really nice is that her skin tone is actually close to what she was trying to achieve. And we didn't really make it like particularly too aggravated with hyperpigmentation. There was a time when, she did get some more pigmentation. I had to clear that up with the Pico laser, and now you can see it's really evened out. So I love it actually because it's like kind of showcases all that, the fact that even with a patient with melasma, we were able to achieve excellent results. How long did it take? It took more than 2 years really for this process actually for this patient. So this kind of skin really did take a lot more work because when I worked on her after the first session, she did get a lot of post-inflammatory hyperpigmentation. I had to work on it with the Pico laser to help clear that up before we felt comfortable doing some more. So this is, sometimes it happens with Hispanic patients with melasma, underlying melasma like that. I had to suppress that pigmentation and really work on it, and we got it there, and so it's awesome. It's a really, really great feeling actually that we ultimately could achieve that. What's the cost of something like this? So most patients spend about $5,000 to $7,000 on their scars. Most patients, if it's more severe like this case, you could be like $10,000 or so. So it's it varies about how much volume it needs to be replaced as well. And what's your input on Collagen? It's not going to be like going to solve something like this. This is way too far. With the terms of the thickness of the scars, things like that. I don't think that you're really going to see much improvement for anything like that. But for people with just like more mild superficial hypertrophy, especially like where it's like a little bit thicker, you could try that. But personally, I think that the best thing is going to be really like silicone tape for like those thick elements of the scars. So a lot of times after we do these laser sessions, I'll have patients for really a few months where silicone tape over there, and it keeps it flat. Actually works really well actually at keeping it flat. A lot of people have hypertrophic parts of their scars. So it's not just the fact that it's indented or atrophic scarring. Everyone has always said it's just atrophic scarring. But the thing I focus on a lot is the thick elements of the scar. You'll notice, look at the thick elements of the scar. I don't really find much in literature or anything like this where it's really talked about this thick part of the scar. Yes, this was over the course of about 2 years for this patient. So it took quite a bit of time. We first ran into a little bit of we ended up getting some post-inflammatory hyperpigmentation. So it was a bit of a setback. I had to resolve that before I ended up doing more treatments on her. So I did it with the Pico laser, which ended up actually improving her skin some more too, actually, which is nice. So the Pico laser worked actually in tightening her skin and actually improving her skin quality some more too. By the way, Kimmy, how are you doing actually with everything too? How has your progress been so far? I know it's early right now. Let's see here. Sunset Chasers is saying that they spent $10,000 on their face and it's still jacked. I'll be happy to help you at some point. I've had patients that spend tens of thousands of dollars before they even came to me, and it says that you said that this looks like your face still. That's really unfortunate. And so hopefully, you could reach out to me. I'll be happy to help you out. Over and over and over again, I have patients that have done a lot of different treatments elsewhere. They've done full big treatments, and I see over and over again, there's room to improve a lot of these scars. I wouldn't feel like it's just like completely hopeless. At some points, you have to look at things and say that maybe we should just look at a different way, and you may just need a fresh set of eyes to look at it that way. There's some people that would just keep on doing the same thing over and over and over again. It doesn't make sense when it comes to scars. I just don't understand what they're doing with this. There's a lot to actually criticize. There's also a lot to be hopeful for. There's ways to get to the skin that you want. It just may take a lot longer and it'll be a lot slower than you may expect. And it's like we have to be patient though with this stuff. Everybody's collagen response is different. Everyone's depending on their age, it's all different. Bao Kimmy saying healing is so good. Just counting down the days to see you again for the next steps. Looking forward to Bao Kimmy. Thank you. How many weeks has it been? Formulations is saying, what are your thoughts on Altrino? What do you think it helps with scarring? I have to look at that specifically. Let me double check Altrino just so I get it before I misspeak. So just the top. Okay. So just all it is just I was looking for which classification of a retinoid it is. Retinoids in general going to help with oil production, going to help with some collagen production, but it's not going to help enough for these kind of scars. These scars, what we want to do is actually break up the scar tissue underneath there, help lift it up there. And on top of it, we also want to actually smooth down the edges of it. Tretinoin may help with the diameter of the scar a bit, but it's not going to really help too much more with that. So it'll help a little bit with the diameter, help a bit with a little bit of collagen production, but it's really not going to soften these kind of thick scars. And most of my patients have already been on tretinoin or trying tretinoin, and they may say it helps a little bit with their acne, but not so much with their scars themselves. How many times can you do that job? What happens if it doesn't work the first time? Well, we could work on it and keep on working on it. I mean, there's not really a limit as long as you're healing okay. As I said, this patient, she did have a setback. She has melasma. You can see some of those little pigmented spots area that she had beforehand, those like brown patches that she had. It made it a challenge, and I did it, and I actually did go talk to her about it, and I did go pretty harsh and pretty strong with it. But in her case, it ended up being that it wasn't just the melasma that flared up. Actually, that was suppressed okay. It was more just post-inflammatory hyperpigmentation. And somehow what happened, I can't recall if she had sun exposure or not, but she had a lot of hyperpigmentation afterwards, and I had to clear that up with the Pico laser, which we did. But that was something that took a little bit longer than just for us to be able to do that before working on her next phase of energy devices. So in between that time, I ended up just doing more like Bellafill and Radiesse, those type of things. Oh, Bao Kimmy's only been 3 weeks and already saying it's healing really, really well. Awesome. Good. That's awesome. That's exactly what I expect. Really, it's usually about 4 to 7 days for a vast majority of patients. If it's a little bit stronger, it's maybe 7 days or so. David Lee saying, how much oil and shine can you reduce with Accure? My nose and forehead are awful. Well, actually, it does a lot. It looks really normal, actually, afterwards. It's really, really nice for some patients who are just drenched in oil. It's amazing. And especially before summertime, it's like you'll notice that difference that in the summertime, that oil production goes down. And over time, you'll start noticing that it's going to feel a lot better for your actual acne. And then, of course, you could even get a bit of a collagen response. So some of your scars and your pores actually shrink as well. Really cool. You have a few different aspects that occur over the course of several months. What are my thoughts on Adapalene? It's great. You can just get it over the counter, which is really nice. So I love things that are accessible for patients. The main thing for all these things, people are asking about whether they should be on Accutane. I saw some people asking whether they should be on Accutane or do the Accure laser for cystic acne. I want you to do whatever needs to be done to help prevent scars. So Accutane, Accure, spironolactone, tretinoin, all those things, oral antibiotics, topical antibiotics. We could talk about all those different options. But the main thing is that I want to avoid these scars from happening in the first place. And actually, interestingly enough, I will say I've had a lot of patients with the who have done the Accure laser now, and I feel like we've really solved and saved a lot of patients from severe scarring. And that also is even for patients that I place on for Accutane as well, of course. And so it's really nice. It's a really great feeling when you see severe cystic acne, and then later on we solve it, and you no longer have, of course, the acne, the redness is down, but you also avoided some severe scarring. You guys hopefully were on last night. You heard the person who was on here, and she was saying that she started having severe cystic acne at 8 years old. 8 years old, cystic acne, that's a baby. And she had severe cystic acne at 8 years old. And, didn't have anything for several years up until the age she was 15 years old. And, everyone will say, well, why not just go on Accutane? First of all, there's a lot of different reasons why people can't just jump in to do Accutane. One is that, especially you're 8 years old, there's a lot of risk involved with it now. It could actually potentially, theoretically, close the growth plates. So you may actually delay the person's growth. And so if parents may be concerned with that, there's also, of course, the concern that it could cause more depression. That's potential real concern for somebody who's worried about already acne is causing depression, and now you do this. It could cause, one of my patients today, she was saying that her joints have been hurting her. Even myself, when I was on it, I found that was the case too. So somebody's on here saying I'm grateful for Accutane, but that was a terrible experience. And that's the same way with me. I was on Accutane 3 times. I know that each time it did improve things, but it was terrible. It was a terrible process. And that's why I did offer, I do offer the Accure. I do want to have different things that we could do to solve acne. If you can't tolerate oral medications, you're worried about oral medications, we could have some sort of other option, because I just don't want you to have this kind of scarring. Anybody asks, if you had acne and anybody asks you what it's like, you could maybe be able to describe that trauma. But there's a different form of trauma than when you have the residual scarring, and it's like 20 years later and you're still suffering from that every time you look at yourself in the mirror. It's really difficult then for people to move on from it, because you're just constantly reminded of it. And there's a lot of patients that really are, they are in like social media more. Nowadays, people try to do those type of things. They don't want to use filters. They don't want to use makeup. And it's really tough, because there's so much pressure to have perfect, clear skin. And it's like you're seeing yourself and it's not as perfect as you may want. It's not the level that you want it to be. Val Kimmy is saying, Accure is truly magic. Trust the process. Appreciate you for that. Thank you so much for telling everybody about that. Val Kimmy did that, and then she also ended up doing the laser for her acne, as well as TCA Cross. PK Farnsworth, good seeing you on. 2 questions, Dr. Qazi. Can you go all the way to the orbital rim for subcision? Do you ever repeat the big session, say a 2-year mark? Good question, really good question. So orbital rim, really doubt it that I would go up there. I'm not even sure why I would have to go up there for subcision. Probably, to be really frank, it's going to be very mild tethering. So I doubt that we're going to have to do too much with that. It's not an area that particularly holds of like a lot of scar tissue, like it's just like pulled down and tethered down there. But if we have to do it with like a little small blunt cannula, I may do like a thinner blunt cannula for that, like a 23 gauge or even a 27 gauge cannula. Just go in there and lightly break up some of that scar tissue. I could potentially do that. The second part of your question is, do you ever repeat the big session, say at the 2-year mark? Yeah, if I have to repeat the subcision, I will repeat it if I have to. But most likely it's due to volume loss, and I just double check if we're replacing some volume, making sure that we can improve that area with volume replacement. And that's really all we need to usually do, instead of doing the fuller, bigger session. But in this case, for example, I had to do another session of ablative CO2 laser, which isn't too uncommon. If it's like thick scar tissue like that, it usually takes 2 times or so for me to smooth that down. Depending on how thick it is, it could take even some more times. And if you're healing okay, I'll keep it up. I'll keep working on it with the ablative CO2 laser for the thick edges of the scar. Hi, I'm up. How's it going? Is it possible to treat scars in front and back of the ear area? Yeah, I do a lot of that. I don't believe you're one of those patients, but for patients who've done facelifts or neck lifts and there's scars behind the ear, that's pretty common actually for me to actually work on that. I do a lot with that actually. Nadia, hello, is saying, Dr. Qazi, can you do subcision on the nose and do you consider acne scars permanent? You could do a little bit of subcision on the nose. The nose tends to take the longest really for scars. So it's a lot slower than people may hope and expect. It's not something that's like, as easy to work with because you can't just excise those scars as easily. You can't do things to just, smooth it down as well because it just doesn't heal as nicely. It may end up causing more scar tissue. So it's an area that does take a lot more patience than these areas like the lateral cheek. You see right here, this is lateral cheek actually solves pretty quickly sometimes and kind of almost completely as well, which is really nice. Middle cheek takes a little bit longer. Areas where there's more tension can take a little bit longer. And the nose, even though there's not much tension, it's just an area that's just not as forgiving if you go too high energy and try to really break it down. You're going to end up running into more problems that way. Is Accure the same as AviClear? So it's the same wavelength. It's actually the 1726 nanometer wavelength, but they're both targeting oil production. I have both lasers. I use the Accure laser pretty much only for our practice. Reason why is I just found that it had really good real-time feedback. So every time we were firing it, we knew that we were getting the exact temperature that needs to actually to normalize the oil gland. So that ended up working really well for us. And that's why I ended up using it actually. And just that's all I use. Brian saying, I'm from the Bay Area. I want to come when I'm 18. Look forward to it, Brian. A lot of our patients come from the Bay Area, a ton actually. I ask them all the time. They're all over the Bay Area, and I'm really familiar with that area. I used to actually work nearby over there in a hospital over there. And so, in a way, it was all at one point. It was almost like an area I was thinking of settling down and living. I ended up coming over here because I was just like weather-wise and stuff, but it was pretty close actually to the Bay Area. Can someone with dermatographia get laser skin treatment? Yes, you could. That's no problem. You likely, for one thing or another, we may not actually necessarily need like the high heat, high energy, unless you have these kind of thick scars. But even still, there's no real contraindication. We can still do these things. It's okay. Sculptra or Bellafill? I'm scared of Bellafill. Well, if you're scared of Bellafill, then we could consider doing something like Sculptra or Radiesse. But we have to talk about why you're scared of it. There's a way to inject it to be really safe. You just do little micro droplets of it and it works out incredibly well. And just go really slow with it. I never shove too much at one time. Sculptra is good for like volumization of like bigger areas, but Bellafill is really, really nice because it gives you some nice support of the scar always in there. So Melissa's saying that she's scared of it because it's permanent. That's why a lot of people actually prefer it because it's permanent. But yes, if you don't want a permanent product, then either Radiesse or Sculptra could be good options for you. Or of course, hyaluronic acid fillers. But personally, I prefer more like collagen producing products like Radiesse or Sculptra.
Yeah, I'm good. I just went down the wrong windpipe for a second. Just a second. So funny enough, I don't know if you're on here right now, my patient from yesterday, he said, I take too short of a water sip. And so today I try to take a bigger gulp and then talk, and then I mess up. So got in my head, he was like, you take too short of a water sip and I'm worried you get too thirsty while you're talking. And I was like, maybe I will just take like a bigger gulp. And then I kind of was thinking too much there. How many sessions with filler sessions does one need? I did one, but scared to get too much filler. Well, it depends. We just do tiny little micro droplets of it, and then we just wait to see how it's going to integrate with your skin, see how it is when you're like smiling and animating, things like that. And just keep on working on it slowly. This patient, she needed several sessions of volume to get to this result. Like it wasn't just like a one-time thing. I want to make sure when we're doing filler, it's just well balanced. It's going to look really good with your natural anatomy. We're going to make sure that when you're animating, you're smiling, things like that, it's going to look really natural and it's not going to look like you got filler. And we could do that, but you just have to go really slow with it. You just can't put it all at one time. Otherwise, you do run into those problems. It does end up getting like really thick, for patients that do filler and they keep on putting filler over and over and over again, too superficial, it could look really unnatural. Today I dissolved 2 patients. They put Juvederm Voluma, one person Juvederm Voluma, another one had Volbella as well. And so it was like, ended up being like too puffy, drew in too much water. Just, you run into a lot of problems that way if you're placing hyaluronic acid filler superficial. And then of course, even with collagen stimulating products, you could actually end up stimulating too much collagen. So if you put too much in one spot, so you gotta be careful with that too. Now they're saying, I'm in Australia area. Do you recommend Dr. Davin Lim? I haven't worked with him directly or anything like that, but from everything I've heard, patients on here have said as well, people on here have said that they've been to him as well. All of us have had good comments to say about him. So he seems to always have known what he's talking about. So definitely someone to take a look at if you're in Australia. Dominic is saying, are halo lasers the gold standard when it comes to targeting acne scarring? No, not at all. Not even a little bit. In fact, I'm not sure who's marketing it that way. I don't know who's saying that the halo laser is something that is the gold standard for acne scars. I know that there's a lot of people that are pushing it. I know there's a lot of people that are saying it. Someone on here is saying that they did 6 sessions of halo that didn't do anything for their scars. It's interesting that it's even pushed for scar treatments. I think it's very, very mild for scars. It could help a little bit for texture. It could help a little bit for pigmentation, but it's certainly not going to really be a solution for the vast majority of scars. Not for these kind of patients. I don't use halo. It's not necessary for my practice. Someone on here is saying halo is mild, and it's like, I don't know why I would limit myself the way halo limits you. And then it's also, a lot of times just people are charging a ton of money. They make you do like all these packages. Did someone make you do a package over there too? I don't know, but it's like a lot of these things. I had patients who they were someone used the halo on them for their scars, and they ended up digging too deep in their skin, and it caused more scar tissue actually for them. And they're trying to do multiple passes and trying to use the halo a little bit more aggressively is what they're thinking of. And you can run into a lot of these issues if you're using the wrong devices like that. Lucky Singh is saying, hi, Dr. Qazi, do you do anything different for international patients? For example, more aggressive treatment. Also, do your international patients get additional medical insurance? Do you suggest it? Good questions. Medical insurance, that's entirely up to you. That's not a bad idea just in general when you're coming across overseas to us, which by the way, appreciate it. But do I do anything different for international patients? Not necessarily per se. Like, we'll talk about things that you're open to. If you want me to push it a bit more, you're okay with the fact that you may have more downtime, more recovery, then maybe potentially I could consider that. I do usually try to push it to the safest limits that I could possibly do with the best possible results that I could do, like each time I'm doing these treatments anyways. And most of my patients are out of state, so I know that I don't have the luxury of having patients that I can just see over and over and over again, over and over and over again. I'm trying to just hit it really, really well. And people are investing a ton of money in these treatments, a ton. So it's like, I know that's like a lot of money for people, and it's like super important for me to hit this like every single time. So it's not really that I do things differently. I just I'll talk to you about even the patients today that came in. Some of them wanted more aggressive treatments, but they were pretty local, and I was like, it's just because for them they don't want to have multiple time off and things like that. We'll have that talk. We'll discuss it with you, what you're open to, how much time off you're willing to do, how much risk you're willing to take for these things. We have to kind of figure out that balancing act for you. And it's totally possible for me to achieve excellent results, even with not using the laser as aggressively as a lot of other people. I don't believe in like high heat, high energy as much as people do. Actually, I'm using it for focal areas. In this case, for example, I said I use a ablative CO2 laser, but that was for those thick parts of the scar. You'll see other people and they'll just like burn down everywhere, like constantly. And it's really, really risky that way. And so this is a ablative CO2 laser with an erbium laser over here. Am I familiar with the Synergy peel? No, sorry, I'm not familiar with it. I'll have to take a look at that afterwards. I don't know anything about that one. Let's see here. Cheyenne is saying, I've done CO2 laser twice and still have some scarring. Any other types of laser you recommend? It's not about the laser. That's all I was referring to. Really, it's not about the laser. It's possible that you could do the CO2 laser 100 times and it's not going to make much of a difference. I had a patient that did it 20 to 30 times, she said. And when I did the subcision, all those things, that's the thing that mattered actually. Those are things that work for her. So you may not even need CO2 laser. You don't worry about like what brand of laser. I saw some questions about what brand I'm using, things like that. Don't worry about the brands. There's a ton of different brands out there. There's people that are out there with good lasers that are totally different than what I use. I may use a totally different kind too. It just doesn't make a difference, honestly. Nobody's ever going to catch me saying that this is like the solution. This particular laser is the best possible laser for these scars. I don't know. It's like the one I'm using. It's really, really good. I like it for that purpose because I use it a certain way. I could do it. I could have good control with it. But I haven't tried every single laser out there. I'm open to like looking at all the different brands. So far, this is the one that works out the best for me. But it's like you shouldn't find that just because I use it, someone else has to use that laser. It's like maybe they don't even know the settings of this laser. Maybe they haven't been as comfortable with it. So they're saying, hi doctor, I live in New Jersey City. Do you recommend an in-person consultation or online to evaluate my scar type? I do so many online consultations. It's never a surprise to me when patients come in. We walk you through exactly what needs to be done during the online consultation. So I absolutely be comfortable with that. So definitely consider that. Hey Masood Amin was coming in from Virginia earlier. Appreciate you coming on right now. Appreciate you so much. Real skin's looking awesome. Hopefully we'll be able to share his result at some point too. But thank you so much for coming on. Let's see here. Utka is saying, sir, what's the brand of laser? Oh, there we go. Another question about that. So I don't mean to laugh like that. I mean just that like everybody keeps asking about that, about the laser brand. It's not about the brand. Anybody that's sitting there, I've had so many people say to me that I was told that this brand is like the best brand for it. This brand is the best brand for it. It doesn't matter as much as you guys think. It really doesn't. It's about like how we're using the device, what precision we're using with it. Like if we're using it with like these little pens that I use for the ablative CO2 laser, I use it like it's almost like a pen. And I'm tracing that, and so it's very, very precise. Those are things that matter. It's not about like the brands as much as you guys think. There's so many different CO2 companies out there, and I don't think that there's that much of a difference. Yeah, like you could say that there's one laser that has this much power, this much power. I never go up to the max power, or even close to the max power. It's so ridiculous for me to go up to the max power. I do it for like testing purposes, just to see what I could do. But I don't go up to the max power. I don't know why we would. The Pico brand. So there's different Pico brands. I use Pico Sure and I use Pico Care. I use both of those. Pico Sure I like because it's the only one in this country that has 755 wavelength, which works really well. Oh, thanks for telling me to put my mic closer. But the Pico Sure works really well because it's 755 wavelength, and that works really well for melanocytes. So you could just target the melanocytes directly there. Leba is saying, is it hard to get rid of boxcar scars on the forehead? It's a little bit slower, but a lot of times they respond very well with doing a little bit of subcision and some filler underneath there. So it's not terrible, honestly. It won't go away potentially completely, but doing that actually works really well and then softening up the edges there. Steph is saying, is tretinoin good for acne scars? It's good in general. It stimulates collagen, so it's good for that. It helps with the oil production, so good for that. But it's not going to help enough for these kind of scars, for example. Phenol peel. So this patient, she is a darker patient, so would be riskier. She would have been otherwise a pretty good candidate. She just doesn't have, she didn't have much of the downtime initially of like just prolonged redness is really what she was worried about. But phenol is good for like those thick elements, those thick portions of the scar. That's where it works really well. And then the next day we have the patients come back so we could do manual dermabrasion. So we break it down manually, smooth it down with some sandpaper. Actually, it's like it looks really medieval to smooth it down, and it works. It works really, really well. And then we could do another layer of phenol as well. Is there such a thing as a one-time treatment for acne scars? A lot of my other patients that I've shown are one-time treatment. It depends on how thick the scars are, how deep they are, things like that. You're probably not going to get complete results with a single time though, but we'll get improvement though over time. Uchkur is saying, I've had Morpheus 8, laser, CO2 for my scars and so many treatments, yet no visible difference. Why does that happen? Again, it's because it's not about these devices. I mean, first of all, Morpheus 8 is not great for
for scars. It's good for skin tightening for like, this patient, for example, she had a little bit of laxity around there, like it was a little bit looser. So Morpheus 8 could help with that skin tightening process. But there's other ways of doing it too. The laser also helps with that too. It's not a great product for acne scars. I'll say it again and again. It's not a great product for acne scars, despite what so many people try to push. It's not a great product for acne scars, and it's good. Like I like it. I have it in my office for skin tightening. I think there's a lot of different radio frequency microneedling devices. I'm not married to Morpheus 8. I'd probably try a bunch of other ones out there too. They're all probably great too, but it's like for the purpose of me tightening skin. That's what it's for. And the people that are pushing it for scars, I think that it could be really, really risky, because let's say, for example, you're trying to do it in this patient, which it's going to be ineffective for anyways. You're doing it, you end up using too much heat, too much energy, and you're doing it at a depth that could potentially melt fat now. And that could be a real problem. That could be an actual real risk that occurs. I know that everybody tries to act like it doesn't happen. All these physicians are out there saying it doesn't melt fat, doesn't melt fat. How does that make sense when it actually was marketed that way by just openly? They actually had influencers talking about how it's melting their fat in their abdomen, things like that. And it's high heat, high energy that you're placing at a certain depth that potentially could be melting fat. And you hear so many different stories of that. And I don't know if it's like been proven or not, but I definitely have heard patients say over and over and over again that they're worried that that these radio frequency microneedling devices melted some of their fat. And again, it's like, you do it the proper way, you won't run into that problem. But if you're doing it with high heat, high energy, and I've had people that told me that the only way they do it is the highest heat and the highest energy for Morpheus 8, and that's how they treat patients. They just go maximum settings, and you're going to run into so many problems. You're going to melt people's fat, and like for scars, that's terrible. For anything, that's terrible, but for scars, it's really terrible. Like that stuff, it's like it's wild to me that just like walking around that people are saying that they're going to do maximum settings on any of these devices without understanding what these devices are or what that means for the patients. Like, what's the consequences of this stuff? What happens when you do that on max settings on a patient with scars? They end up melting some of the fat, and then what does that look like? This patient, no, she did not have Morpheus 8. I was just saying because someone on the chat was saying that they did Morpheus 8, it didn't work, and I was just explaining that it's not going to help much. It's really not. So Utkur is saying, I've tried almost every treatment and there's no visible difference. Why does treatments not respond? Utkur, I'll be happy to help you. I mean, there's very, very few people in the world who do this consistently. Very, very few people. And so it's possible that you just need a separate, another set of eyes to give you some guidance on what to do, at least. It's tough to say without knowing, what your skin condition is. But it's unlikely that you tried everything. It made you that even if, like, I had a patient that did 10 subcision sessions, I ended up going in there and breaking up that scar tissue, and it worked, just like that. We lifted up those scars. There's so much tethered scars in there. And he did 10 or 11 sessions of it. So it's like, it doesn't matter. It matters is where they go and who they do it with. And maybe also if they had new scars, new acne afterwards. Phenol-peel and fully ablative CO2 because of type 4 skin. Is that something recommended for type 4 skin? So phenol-peel, CO2, yes, we could do it for type 4 skin. It just has to be the right candidate, the right person. Mary, how's it going? And Mary's saying, I love your work and need it, but definitely can't afford it. So, if you can't afford it, first of all, I'm not sure if you can't afford anything. I'm not like saying, I don't know what your budget is for any of these things, but, try doing Tretinoin, try doing like a topical retinoid. That is something that's just help with oil production and potentially sometimes can shrink the diameter of the scars over time. Something to try, but you have thick scars. It may be that you have to do something that I have to work with. And we have a lot of different payment plans, like pretty much everything. And everybody's just like using Cherry right now. Everybody's using that. And, we also do Accure credit, all the other ones. So feel free to take a look at our page. Our prices are on there, and maybe there's something which you thought was more expensive than it is. It turns out that it's within reach, actually. VIP Star saying, sir, I am from India and applied a cream which left a mark on my face. This can be removed with CO2 laser. Not necessarily, actually, usually that sounds like more like hyperpigmentation. So in India, try to find someone with a Q-switch laser, or if they have someone that's over there with a Pico laser could help out with that. You may need to do that. Best treatment for ice pick scars. That's usually going to be more like TCA Cross and excisions potentially. That's usually the case for that. Do I do free consultations? No, my consultations are not free. They are on our page. You can just go directly on there. I will go in depth with you. I'll help you out with everything and make sure that we get a beautiful result for you. But it's important also that I could spend my time with all my patients and everybody's like fit properly in there, so I could just make sure that everybody's seen, and consultations are not free. Let's see here, but it does get applied, by the way, towards your treatment, at least for now. Right now, we're doing it that way. You do your consultation, it gets applied towards your treatment. So just so you know. Let's see here. Is TCA safe if you're olive skin tone and prone for hyperpigmentation? I would say that it's safe if it's done properly, and if you use the pigmentation cream that I use, then it's safe. But otherwise, I have a lot of patients that ended up just like someone put TCA on them, and then they did get PIH, post-inflammatory hyperpigmentation. So it depends on who you're going to. Can you use Pico to prevent PIH for scar lasers? Yeah, that's what I had to do for this patient. We had to do the Pico laser. She ended up getting some PIH afterwards, so I had to use a Pico laser for her. Yeah, you definitely have to do it sometimes. If we need to, I have it. That's why I have it there. What cream? It's on our website. You can just go on our website. It's a pigmentation cream from there. Which retinol do you recommend to start with if it's the first time using it? Different cream. Just pick up different. It's easy to pick up. Just go there, get it from, I was going to say Target, but I don't know. I guess Target's now kind of on the bad guy list now too. But I guess somewhere, maybe like a local, shop local, I should say. Try to get something else from somewhere else, but different cream. What are your thoughts on using tretinoin on skin like this, and your thoughts on tretinoin in general? So tretinoin is not bad, just as like helping out with acne, and then also it can potentially help stimulate some collagen production. So it's good for that, but it's not going to solve like these kind of scars. That's the thing. What's a time frame to start seeing your difference after Bellafill and subcision? Well, you'll see some improvement usually about a month or so afterwards, but you may need more Bellafill. It's just that a lot of times it's really, really soft, and I don't know how much Bellafill you got placed in there, but you may need just a lot more. It takes a lot more than people expect, actually. PhotoFrame is saying, doctor, TCA Cross 70% was using a few scars, but it made it broader. It looks like it melts the skin and forever, and is still bigger than before. I'm sorry that they did 70% on the full face like that, but I've done with a lot of patients who've had those kind of complications from TCA. I had a person who she was getting applied the TCA, and she said that they ended up using like a lot of a cold air on her face, and it splashed the TCA all over her face and it caused severe scarring. Really terrible, actually, situation. Really terrible. I had to fix that. It worked out really well, actually. I've seen her now. It's about 1.5 years of work, and it's really, really soft, actually, right now. But it was, traumatic for her. She went to somebody she trusted, and they ended up blowing the acid all over her face. It's like a severe acid burn. Really sad. What do I think of the Luca trade? Good question. I follow more like players in general. I like Luca, so it's like I don't really care too much about like the teams per se. I like the players, and Luca is like a player I like, so I'm going to enjoy it. I don't know what they were thinking though. I'll just say that I don't know what they were thinking with that whole thing. But okay, it's like whatever. Like hopefully you learn some really great tricks with LeBron. I mean, that's gonna be amazing, and maybe better conditioning. That'll be awesome. Do you recommend reaching out to you if it's hormonal acne, or do you think it should go on meds for the hormonal? You should absolutely try to do medications like oral birth control. Something like Yaz could work out well. Oral spironolactone could help as well. But if you want something that's a more long-term solution, then the Accure laser could help out. You could do isotretinoin, all those potential options there for you. Monet saying, how long do you have to stay out of the sun if you have TCA Cross and fractionated laser done? At least several weeks, really. Honestly, it's going to be like a while. If it's red, it could turn pigmented, so just take a lot longer than you may expect to go out in the sun. Just in general, just avoid the sun. I avoid the sun all the time. So I just wear you see me sometimes. I wear like this face mask that's like this face shield a lot of times. You may see me walking around, that's me. If you see like the curls above there and you see someone with like a face shield, that's me. The name is Jesus. Hello, Jesus. What do I have to achieve to get the results from the pictures? Or what do I have to do? A few things. Basically, we did subcision for this. We went inside, broke up the scar tissue. We did TCA Cross as well. We did ablative CO2 laser around the edges of the scar. We did a lot of volume replacement as well. So we ended up doing things with like Sculptra. We did Bellafill, and also through the laser tunnel holes, we put a dilute form of Sculptra as well. So we did a few things. What is the difference between CO2 and phenol peel? So phenol peel is really the full face. Every aspect of the face is really covered. The eye area is covered, even the lower bit of the lower jaw is covered, chin, mouth area, everything's covered really at a particular intensity, depending on your skin type, depending on your scars and your skin condition. And then a CO2 laser, I do more for like focal spots. I do it like for those thick elements of the scar, I'll do the CO2 laser. We don't necessarily have to use that much heat and energy the rest of the face. So less downtime. You may have to repeat the CO2 probably maybe a few more times than you would just with the phenol, for example. But there's a lot less downtime with it though. So that's kind of typically the main thing. A lot of times the downtime for phenol could end up being like 3 months, a lot of redness there. Kobe's saying, hey, how long should I wait after my Accutane treatment to see you? Well, it doesn't matter really. I could see you, and then we may even do the treatments earlier, depending on what we have to do. You don't have to actually do this whole long waiting process for it. I'd actually rather treat scars earlier, so just schedule a consultation. I'll be happy to help you. Rome is saying, my teenage son started Accure laser. He's experiencing some breakouts after his first treatment. Is that normal? How many treatments would you say we will start seeing the acne controlled? A good question, Rome. So Rome is saying they did the Accure, did one session, and started experiencing some breakouts after the first treatment. So there's still this bacterial component that we have to solve. So sometimes we place patients on dapsone as just like a sulfur medication to help with that. And we may even add like clindamycin as well. That could be an idea. I also want to make sure your son has stopped all active ingredients. So things like glycolic acid, azelaic acid, all retinoids, all should be stopped as well. A lot more moisturizing as well. So that usually is what I usually recommend. Even Claritin actually could help with the histamine portion of these little flare-ups that could occur. And you take Claritin, take that every day. That could actually help out as well. It's going to take a while for the oil glands to actually normalize. Usually it takes like 3-6 months after we do the Accure laser to actually normalize. And in between that time, you could do something like broadband light, IPL to actually help with bacteria. We could do topical antibiotics. We could really work on it to see how, depending on how severe it is. But just send us a message and we'll be happy to help out with any breakouts though. Timber saying, hi doc, what do you think of ECO2 laser from Lutronic? Is it a good laser for shallow ice pick and boxcar scars that were already treated with TCA Cross? So again, it doesn't matter about the brand. Don't worry about the brand. If the practitioner is comfortable with that, I'm sure it's going to be totally fine for you. Really just focus on that part. Don't worry so much about other things. How long apart were these? This is about 2 years or so for this patient. Let's see here. Deborah's saying hydroquinone is not helping her hyperpigmentation. Also using Tretinoin 1%, we may need a laser like the Pico laser. That can maybe be an idea. So schedule a consultation with me. We'll be happy to take a look and see if that's what's going to be the case. NA is saying, I got CO2 and I think it was left with hyperpigmentation. It's been 3 weeks. I hope that you were placed on something for the hyperpigmentation, but it's really important to start tackling that really early on. So hopefully, you could talk to your practitioner to get that solved for you early on. Is a mini facelift good for thin atrophic scars? It's probably really aggressive for that. I'm not sure if you really need to do that. I've had a lot of people that have done mini facelifts or done facelifts that they find it helps a little bit with the scars, but it's not really like the biggest solution for that either though. So you have to do other things too. Would you recommend Pico for dark underarms? Yeah, we do a lot of that actually. It works really, really well for dark underarms. So definitely would say that could be an option for that. Usually you have to be on something that's like a topical cream to suppress it. Depends on what it is. Let's see here. ROC Donk is saying, I did TCA with an esthetician. After a few sessions, I switched to an aesthetic physician who said they would not have done TCA on my South Asian skin type because my scars were now pink and hypopigmented. Does TCA carry this risk? I'm not sure if my scars are pink or actually permanently hypopigmented. Tough to say if it's permanently hypopigmented. I'm not sure how far apart this was when he evaluated you, but it is a possibility if they're using too high of concentration, which is why I always change the concentration of my acid depending on the depth of the scar. it really does matter. You want to make sure that you don't actually use too high of concentration. Some shallow scars are shallow. You don't want to use the same concentration as a deep scar. It doesn't make any sense to actually do that way. LA is saying thoughts on Clear and Brilliant for minor acne scars and melasma in a Middle Eastern 40-year-old. I would not recommend it. I would not, unfortunately. I've had a lot of patients who said that they've tried it many, many times, and sometimes their scars were mild. It sometimes exacerbates their pigmentation issues. It does, very, very minimal for the scar. That's the things that a lot of patients have said. So I wouldn't recommend it. Yeah, and someone on here is saying Clear and Brilliant has not helped them for their scars. I would say the same thing. So it's like I wouldn't really recommend it. Michelle is saying, does ECO2 help with dark circles? CO2 in general doesn't help too much with dark circles. Especially a lot of skin types actually could cause rebound pigmentation. So I wouldn't really recommend that. Do you treat scars on the back? You only show the face. Well, no, I do a lot with the back as well. Usually we use Bellafill for that, or just more manual type of work. Sculptra, for example, is another option. Subcision, those things help a lot. So that's usually what I recommend. Photofram is saying, do you think dermatologists not only don't do good work so that patient comes again and again for treatment? If they cure quickly, they lose the patient. That's a really good question, actually. Let's actually ask this question again. Let's just say this again. Photofram is asking, do you think dermatologists not only do not do good work so that patients come again and again for treatment? If they cure it quickly, they lose the patient and they don't make money. So I would say, first of all, that I don't think that's the case, really. I don't think that the people are really thinking that. The vast majority of dermatologists are not thinking that they're going to try to squeeze money out of this. A lot of the dermatologists in my area, for example, they refer their patients to me. They can make a lot of money just doing these scar treatments. They send the patients over to me to do these treatments. So very ethical, it's very ethical. It's the right thing to do, basically, if you don't specialize in certain things, just to send it over to somebody who does do a lot of it and does it safely and does it very effectively. So a lot of that exists. There's a lot of like a high standard to making sure that you could do great work. And you want to make sure that if it's something you're not too comfortable with, you don't do enough with, it's skin type is something you're not comfortable with treating, you'll send it out. But are there a lot of people out there that do unethical practices and do try to do treatments that are useless? Yes, absolutely there are. And that goes with not just necessarily scar treatments, but that's also really with acne. That's with like pigmentation as well. That's almost with like anything in healthcare and medicine, unfortunately. I think, anybody with any health condition, it doesn't have to be like acne or scars or pigmentation or just like the anti-aging process of things that we're talking about. It could be like any health associated issue. You should look at it and think about the fact that this is a terrible, terrible system. And it's really, really unfair how it affects poor patients, poor people more than it affects people with money. It affects people based on the way that they could access the care, how direct the care could be. And sometimes their insurance, even if it's good, there's still an enormous amount of out-of-pocket costs that they have to do. And some of these things that are these out-of-pocket costs, it seems like it's not that much. It's like $150, $200, but some people are just living paycheck to paycheck. And they're going to look at things like if they have other health conditions like diabetes or anything else out there, heart problems, anything else, and they're looking at between solving their making sure that they could afford their insulin versus getting Accutane. They're going to choose probably their insulin because that could potentially kill them if they don't get their insulin. And it's wild to actually think that. It's really, really wild that insulin that's like $36 ends up being $550 just like that. So really anybody with any health condition really should be looking at this as this system is really unjust and just doesn't make any sense. And even if you have a lot of money and it's just doesn't bother you and you're walking around it doesn't affect me, well, just it affects a lot of people. It affects a lot of other human beings. And it's really, really terrible. And it really should radicalize everybody. Anybody with a healthcare condition should be radicalized, because it's you look at this and you try to navigate this world and it's WTF, what is this? What are you dealing with here that you have to deal with over and over and over again? And when it comes to acne, you have this situation where you're put on these creams that are very, very expensive, and you do this every few months and you're put in antibiotics and you just go through this whole cycle over and over again, and you're paying these fees every few months for this constant same thing over and over and over again, that's, really challenging. And it's really tough sometimes to get to the right practitioner then within that thing. And now if you have scars, it's not even covered by insurance. You're paying so much for insurance, and it's not even covered by insurance. They just say it's a cosmetic issue. So really, I mean, anybody with acne and with scars really should look at this as like, this needs to be overhauled. This whole system needs to be overhauled. And if you don't have that, that's okay. But like, you should see, like, if you have a healthcare condition, you've navigated this world, and you could see that it is really messed up, that the access to cure is really terrible. Joey's saying, I was radicalized when I learned about the golden rule: treat others the way you want to be treated. That's interesting. That's an interesting way of saying it, that you were radicalized when you learned the golden rule. That's a good point. Lupe is saying, how many sessions of Pico help for severely dark underarms? Usually it takes several months, actually. It's not like a one-time type of thing. It's usually for any types of pigmentation. It really does take about 6 months usually for pigmentation. Can I treat my acne scars while on Accutane? Yes, you could. You could do that while on Accutane. I was talking about that earlier. It depends on how much, like what kind of scars you have, how much energy we have to do, and what dose we're placing it on. Those are things that really matter. Is doing 10 milligrams of Accutane enough? Depends on your size, depends on how much oil production there is, how much acne there is. All those things matter, really. Are you able to do subcision around the temple area? Yeah, I do it all the time. Definitely could do that, depending on how thick it is, depending on if it's really needed or if you just need to do some volume too. Those things actually what we pay attention to. Can you send us, or can we send you photos and you could give us a recommendation of what we could do for our scars? Yeah, you could do a consultation, but we also have a forum on our page. You go to drqazi.com, go to the forum, and you actually could submit it on there. And every once in a while, I'll use those photos if I need to, just like throw something up there. I'll throw it up there and I'll go through your case and we'll go talk about it. Sometimes people get confused and they say, where's the after result though? But I'll just say, this is just a consultation. Like, this is just like me just saying what I would do if you were, in front of me. So send it, you can put it on the forum and I could take a look at it. Anita's saying, do scars really go away? I lost hope on my skin before. It's slower than you may think, and it depends on the kinds of scars you have, depends on how good you are with sunblock, but they could be really minimized. Even this patient though, it's like there's still some texture, there's still some scars, and it's, it's still there. It's just a lot slower than you may expect. There's a lot of damage that happened with your skin. It takes a lot to repair that, but at least we could do it. At least we could do it there. Timur is saying, hi doc, I did my 3rd TCA Cross session recently. Most of my ice pick and boxcar scars are very red inside and they stayed red. Some scars return to skin's normal color within 10 days. Why is that? Just moisturize right now. It's new skin that's forming right there. Don't worry about it too much, actually, to be honest with you. Just try to moisturize a lot. It's pretty early on right there. Do you perform a cure laser session before or after the big session? Does it depend on the patient? It depends entirely on the patient. Have I done that? Yes. It depends on how much heat, energy I'm going to be using. Those things are what I'm paying attention to. How much acne you have, how much oil production there is. So that's what it is. I'm up and saying these streams have low-key been my therapy for the past 2 months. I'm glad. I'm so glad, actually. Thank you. I hear a lot of that. A lot of patients, they come into me, they tell me that to my face too. People on here say that as well. And it's I think necessary in this day and age. I think people just need to be open about stuff. We have to just really talk about like the things that are really upsetting us, because all that's happening with all of these things that we're just upset, and we're just holding it inside, or we're trying to like put our head in the sand and nothing's getting solved. And it's just time to just like face things head on and like stop being so scared of everything and just looking at things and like, this stuff needs to be changed. It just can't happen over and over and over again. We just have the same problem generation after generation. We got to just break this generational trauma. And acne is actually a form of generational trauma as well. A lot of times it'll be like, a parent has acne as well, knows what it means to suffer from acne. They don't want their kids to suffer from acne, but they also are sort of lost in how to do things because they tried certain treatments and it didn't work or made things worse. And so they're kind of frozen in that. They know that like when they're placed on just like doxycycline for like 6 months, a year, it upset their stomach and they're just like worried about that now. They know that like when they were on Accutane, Tretinoin for a while, that maybe made them more depressed or caused more problems or caused hair loss, things like that. So they get concerned, they get frozen with that stuff. And it's like you're kind of reliving that now with your child. It's like, it's difficult. So we have to break that cycle at some point. And here we are, here we go. We have to actually break that cycle, and like this is one part of the cycle that we're going to break. There's a lot of different things, a lot of different trauma that's out there. But I think we actually do that. We actually are breaking it, little bits and pieces. It may not be so visible because there's so much like negativity out there. There's so many people that try to crush like hope out there. So they want it. They love to crush hope. They want people just to continue to just put their head in the sand and just be good worker bees. Don't don't talk about the system. Don't complain about the system. Nothing you can do about the system. There's nothing you can do about it. Just worry about your own life. Worry about like the paycheck to paycheck. Don't even think about anything else that's going on in the world. Like that's their dream. That's actually the goal. It's like the goal of like the whole process here is just like put your head in the sand. Don't worry. People are like really intelligent out there. They're going to solve it all for you. And just like keep focusing on your job and making some money and the paycheck to paycheck. Don't think about anything else. And it's like nothing's going to get solved that way. Nothing's going to get solved. We just keep on just thinking like, all I can focus on is just my own job and nothing else matters in this world. Everything gets connected. And you guys are living through that right now where you can straight see right here with acne, with scars, all these type of things. You can see the consequences of access to health and the consequences of poor education. All that actually is the results. This is what ends up happening. Things like that happen, and it's a systematic problem. It's not just like a thing where you just look at this and you say, "Well, it's just I have my own problems, and I can't solve anyone else's problems." It's like, sure, I want you to feel like you can get comfortable enough where you can help other people. I do want you to be in that place, but there's never a perfect time to help people. Just so you guys know, there's never like this great moment in your life where like everything's going super well in your life. You're making a ton of money already. And it's like, this is just like, you could just help everybody. It never works that way. Nothing ever works like that. There's never like this perfect time for these moments. It's not like this perfect time to get married, not like a perfect time to like have kids and things like that. But like, you're like, it goes and you like think, okay, this makes sense at this moment. Let's do it. Let's work on this now. And like, that's what you look at. You don't think like, I have to have like this absolute perfect moment to do this and to help people. So instead, look at it that way and think to yourself that maybe within every world you're in, there's little moments that you could potentially help. And maybe someone's suffering also from acne and scars. And you could be a bit of more of a support system for that person instead of just like, zeroing in on your own problems. Maybe you could tell them that, I suffer from something too, or just so you know, and don't worry so much about it from me. Like, I'm not going to judge you for anything. And maybe just like, it's hard to kind of say that stuff or just like talk to people just directly, and just be normal with them and just look at them in the eyes instead of looking at the scars. And maybe it makes them feel really good. Maybe just little bits like that can make a big difference in the world. Do you only use Bellafill filler in the scars or can you use another filler? Yeah, we could use a Sculptra, we could use Radiesse, we could use hyaluronic acid filler. All those could be options there. Guys, I appreciate all the questions. I had a lot more questions that I know I missed, but I'll be happy to help you with that tomorrow. I'll finish up just a little bit with this. Dr. Emery saying, what do you think of Radiesse on acne scar treatment? It can work really well. I just usually don't love doing it at the same time that we do subcision. So usually I don't do like those dilute ones at the same time as you do subcision, especially the lower part of the face. Upper part of the face, maybe something like that, but I usually don't do it that way. Thank you guys.